so I'm doing this video to show how to administer all 3 different injections that we can do. Before I would come into the room, I would go ahead and do my 2 checks at the Pyxis and make sure I have the right medicine. Some hospitals require that you draw it up in the needle and put the tape on the side labeling what the medication is, and some will have you bring the vial into the room. I would go into the room, knock on the door, introduce myself, explain what I'm doing, ask them for their name and birth date, and I would also check it myself on the hospital bracelet. Ask them if they have any questions. I would go ahead and perform hand hygiene. And then the first one that I'll do is the subcutaneous injection, which I do already have drawn up and ready. And then subcutaneous injections can either be done at a 45-degree angle or a 90-degree angle, depending on how much subcutaneous tissue the patient has. And they are usually used for like insulin shots. So we would go ahead and clean the area with an alcohol pad. But I already have the shot ready. So if I have someone who doesn't have a whole lot of subcutaneous tissue, we'll go ahead and find a spot and I'll pinch the skin together a little bit. And then I want to go in at a 45-degree angle with the bevel up. And then you want to let go and let the skin relax. Before you inject the medication, you're going to grab the needle with your non-dominant hand and stabilize it. And then you're going to inject it. And then you want to pull back and put it straight into your sharps container. And then if you have someone who does have more subcutaneous tissue, you can use it at a 90-degree, where you're going to just hold the area with your non-dominant hand, put it in 90 degrees, inject the medication while holding it stable with your non-dominant hand, and then you're going to pull it out and straight into the sharps container. Try, yeah. Okay, and then the next one that I'll show is an intradermal. Intradermals you have to put in at a 5 to 15-degree angle, and these are usually used for like TB skin test. When you do that, you're going to want to make sure it is also bevel up and hold the skin in it. It's almost flush with the skin right here, and you just want to put it in a little bit. And then I'm going to stabilize it with my non-dominant hand, and I'm going to put the medication in, and then you'll pull it out. And then right away you would also want to put this in the sharps container as soon as you're done. Okay, so the next one is intramuscular. For this one I'm going to do about 1 ml. So you want to bring it back and make sure you have enough air that you need. You're going to want to take an alcohol pad and clean the top of this first, and then put it in. Put the air in that you need, and then hold it up and draw it back to the 1 millimeter. Okay. And of course you wouldn't want to put the safety on it or anything until you're ready, and then you would go in. There's 2 different ways to do the intramuscular. You can do it at a 90-degree angle, which I would hold the skin taut, and then I would just go straight in, inject the medication straight out and into the sharps container. Or I could use the Z-Track method, and that is where you hold the skin back, and then you would also go straight in at a 90-degree angle. And on this one, you can't really stabilize the needle, so you have to pull your hand up and just inject the medication, and then you pull it out. And then with all of these shots, you want to make sure every time that you are using your non-dominant hand to stabilize the injections. And with all of these shots, you're also wanting to make sure that you clean the skin beforehand with an alcohol pad, and you want to make sure that the needle goes directly into the sharps container as soon as you're done. Is that it? Is that it?
Yep.